Today we will present a project on infectious waste in Ban Khong Wanphen Health Promoting Hospital.
Infection waste has been a problem from the past to the present due to the provision of medical service causing the waste to become infected. Therefore, infection waste must be managed in a hygienic manner to prevent the spread of germs to the outside.
1. To study the management of infectious waste in Ban Khong Wanphen Health Promoting Hospital. 2. To study the guideline for the correction, improvement and development of infectious waste in the Ban Khong Wanphen Health Promoting Hospital. Infectious waste is waste that contains a concentrated amount of pathogen, including waste generated from the medical examination process and medical treatment.
1. Contact with all types of secretion, such as cotton, gauze, curd. 2. Sharp material such as needle, blade, syringes, glass tube. And 3. Vaccine infection waste such as vaccine bottle. Infection waste segregation. Infection waste is separated from other types of waste, stored in a safe container.
Infectious waste container is processed to secretions. It looks like a procreate bag made of soft material, not easy to tear. Chemical resistant, there is a rag bag tag that can read clearly. Infectious waste.
Infectious waste containers, sharp type and vaccine type. It should be a box made of strong materials, puncture resistant with a tyrant. 1. Infectious waste in contact with secretions containing no more than 2/3 of the rest containers capacity to leave space to hold and tie the bag tightly with a rope. 2. Infectious waste, sharp material and vaccine infectious waste contain no more than 3/4 of the container capacity to leave space to cover the container and prevent spill.
1. Operator move and source infectious waste must pass the training course for prevention and suppression of infection in accordance with the notification of the Ministry of Public Health. 2. Workers must wear protective equipment at all times, such as treat, rubber gloves, apron, mask, nose cover, and rubber sole shoes. Satahip Hospital, Kilometer 10. This is the host hospital. A budget has been established by hiring private company that specialize in infectious waste. It's possible to collect infectious waste on Tuesday of every week.
Infection waste is received from villagers in the community for proper disposal. Make during the spread of COVID-19 the amount of infection waste received the specified amount. Ban Khong Wanphen Health Promoting Hospital had a discussion with the villagers who dispose of infection waste and additional fee will be charged.
In the past, infectious waste was disposed of by itself and incineration with a waste incinerator, which will have a lot of smoke coming out causing harm to in the environment and people in the community. The Satahip Hospital, Kilometer 10, which is the host hospital of the Ban Khong Wanphen Health Promoting Hospital. Therefore, a private company was hired to collect the infectious waste and dispose of the properly and appropriately.
From the interview about infection waste management, Ban Khong Wanphen Health Promoting Hospital has sorted infection waste. The
The infection waste that has come into contact with the secretion is stored in red opaque bags. Child infection waste and vaccine infection waste are stored in boxes made of strong materials for easy storage, transport, and safety for staff. And the problem of increasing waste, the villagers in the community were informed about the collection of additional food. And the problem of self-incineration of infection waste that affect the environment. There has been a change in the form of infection waste disposal, hiring private companies to dispose of in a proper and appropriate manner.
Please press like and share for us too. Bye bye!